Okay, thank you. I'm going to make this very brief. I'm sure everyone's starting to flag at the end of what's been an exciting day, but just still lots of things to get our heads around. And I think just before I start talking about our local team and who's involved and the timeline, just a few comments about the potential of this program. And I think there's the potential for fantastic collaboration. As was said earlier today, business as usual in our health system is not an option. And so we do need to keep looking for ways to improve the current situation. And I sit on quite a few committees at North Shore. I'm in clinical practice as a GP. I work at the university across all these different ways of trying to make health more accessible, more efficient, more efficacious for the patient. And I see lots of themes in this pathway. We can do that. We can educate our health professionals, certainly the GPs are looking for some fantastic education. We can educate our registrars. Hopefully we can build understanding between all the health professionals and GPs as to what everybody does, that increased understanding as to where each of us sit and the role we play. Because unless we understand all that, things are always going to fall over. People are going to get lost in the system. We're all going to get frustrated by the lack of progress or activity. So I think this is a fantastic place to start, and I look forward to probably working with all of you in work groups and things like that over the next few years. So just to talk about our local team, which has been, it's been quite a fast process, and so I was invited to participate in this role a couple of weeks ago, but I've spent a fair bit of time with Western Sydney, so as well as, I know the Sydney Health Network is extremely active, and in fact someone that I know has been the clinical GP lead at Western Sydney, and going through the whole Health Pathways process with her one day was really exciting because I think it marries so many interesting things together. So here in this particular diagram, I first did also like to introduce just Marie Carey, who's going to be here in the operational committee with me. So the team's going to sit here, and then what we're going to do is attempt to feed all our information and get some direction from the clinical councils, both at the primary health network and at the LHD. And with that integrated care committee, take things up, because we've got lots of priorities. Everyone sitting here who has a service, that's their priority. That's why you're here. And I really get this sense of we're going to have to manage that process, because I know there are so many important things we do need to try and sort out in health, but putting them into some sort of list of necessity is going to be a real challenge. So as we go up to the joint executive, I think that's where those priorities are going to have to be set out, and that information fed back to us, and that's where we start our process. So we certainly do have some health priorities, and we need to work out how we can best get this information together and get it out there and being used. Do you want to add anything to that, Marie? Oh. Yeah, great. So we thought we'd just put up the key contacts at each of the the main sites. So at the Sydney North Health Network, I'm going to be the GP clinical lead, and with Marie, we're going to try and coordinate this whole process. The role of coordinator is still imminently about to be appointed, and so we'll need to induct that person and certainly get them up to speed with the whole coordinating or managing role. We do have 4 GP editors, so we haven't gone with the 8 and we haven't gone with the 2. We've gone with the 4 because I do like the idea of collaborative learning and people having particular interests in things, and I think the role of the GP editor very much is a bit of a dog with a bone, and you've got to go and find this information, you've got to track these people down, and if you have a particular interest even within your practice to do that, then it really leads, you want to find out that information, you want to make this the best pathway for our local area that it can possibly be. And Cynthia, I don't know if you want to say anything, but Cynthia sits above that as the manager of all our primary care and integration. And over on the LHD side, Sharon and Marie And again, we don't know about a program manager who'll be helping drive the contacts within the LHD that we can come together and start our working groups. So there's still a little bit of work to do as far as personnel, but we're pretty keen to get started because we do have some timelines that we may talk about a little bit later as to how many pathways we want to get out, by when, and have some of those deadlines. And here is that timeline that we're working towards. So hopefully some 30 pathways developed towards the end of this year. And as we sit here in the middle of May, it's going to be quite busy and exciting and hopefully very productive. So pathways are going to be launched, going live, yes, sometime towards the end of the year. And we don't have a number either. It won't be. I don't know if it'll be 19 or 18 from Sydney. Who knows? We'll see how it all unfolds. And I look forward to the challenge because I think there are many, but certainly not unsurmountable. So insurmountable. Can't even speak. Lucky I'm not a writer. Okay, that's all I'm going to say. Is that right? Yes, but now I'd just like to hand over. I'd like to thank our project team so far. There have been lots of people at the Health Network working exceptionally hard to pull all this together, to get all the information, and who are going to help us really progress this program. So a big thank you to all of them. I'd like to introduce Magda Campbell, who's the chair of the Sydney North Health Network Board, and then Andrew Montague. So yes. Thanks very much, Magda.
Always like to. Thank you, always like to get in at the end to make sure that we have the whole picture. And I suppose that's what I want to focus on. So we've talked about one program here called Health Pathways. A lot of the questions that were asked this morning and have continued this afternoon actually look outside of what Health Pathways is in terms of the picture that we have for our PHN. Prior to the federal government coming up with their patient-centred medical home, of course, a number of the PHNs have been talking about this, and our PHN is building itself on a person-centred medical home. To make that happen, if you remember back to the very first, one of the first pictures that Linnell put up and Andrew put up, we talked about having the person in the middle and all the care around them and the services. Now, as the board has looked at this first 12 months, we've had to make sure that all the Lego bricks, I think somebody used that term earlier, were put in place to make sure this is actually going to happen long term. One of the bricks is Health Pathways, but it isn't just by itself. It actually builds into a lot of other things that we've been doing. One of the questions this morning, and we keep going back to it, is about the data and making sure that we know that whatever we're doing is actually good value. Believe me, the government changed from divisions to Medicare locals and then to PHNs. We got the message. We know we have to show that what we do actually makes a difference. So we've actually looked at the quality improvement and how do we measure it in general practice. There are a number of systems out there. At this point in time, we've started to put a system called PenCat into general practices that allows us to gather de-identified data. There are a lot of other research areas that are looking at how to get that de-identified data, actually even right down to a patient de-identified level, so that we can actually look at what's happening with the patient, where do we have to aim our education at to make sure that somebody is actually realising there is a health pathway for that, and that patient could have gone straight to this place. The system's changed, and maybe keeping that up on your, we talked about having it up on the doctor's actual desktop and making sure that they're using and utilising it. So we had to make sure that we had that quality improvement tool in place. We had to, negotiate and talk to Health Pathways, be sure that was right for our fit. And then, of course, as well as that, looking at the evidence-based medicine and developing our clinical councils and community councils to make sure that we get that input from them to ensure we're going in the right direction. The IT systems within general practice we've talked about this morning, and we have to actually, of course, ensure that we're getting good talking between the different systems. I think the Adventist Hospital were putting a point forward of how do we make sure that we actually have the transmission and referrals out from Health Pathways. And there are a number of different programs, as Central Sydney were talking about, that you can actually use to link with going from the Health Pathways to the database out to the referring system through a secure messaging system. Our LHD uses Argus, and all general practices have Argus if they volunteered. Have Argus on their computers to actually receive that information. But there are other systems out there, HealthLink and various other ones, and newer systems that are being a little bit more purpose designed so that they actually do this linkage better. So there's a whole heap of questions that we've asked that we have actually already looked at, are addressing in the longer term, and trying to ensure happens so that we do get this streamlined, I like the name of your company, Streamline, but a streamlined system of care, the best care, as Nell was talking about, and the right care, right place, right time, without overburdening all the various services. Fiona alluded to, of course, the fact that we're realising that you guys really, everybody wants to talk to us, and we're trying to juggle all of that, make sure that we actually prioritise so that we actually can, of course, talk to all the various different groups, but it may take time. So just be patient with us, and you know, we're still in our infancy, you know, you've got to work with us to try and actually help develop this mature system from the community, which surrounds, of course, the patient, right out to all the specialty areas, and making sure it all works well together. You know, from our point of view of the PHN, I want to thank all the people who've turned up. It's been fantastic. We've actually got another day of it tomorrow with people who are working within the groups, the initial groups, so giving them education as to how that's going to work and helping them. And then tomorrow night we've actually got a group of 40 to 50 GPs from our area who are specifically coming to talk to learn about health pathways, so that we try as much as possible using all those various different communication channels to get the message out that this is actually where we're going in the future. So thank you very much for all attending, and Andrew, I think, wants to have a final say.
So yeah, I just basically wanted to say thank you everyone for attending on behalf of Northern Sydney LHD. Today really is just a starting point for a lot of us. We really do need to look at it as an opportunity. Without actually building our partnership with the PHN, certainly us as a public health service, we can't continue to do what we're doing. And I don't think the patients would like us to continue doing what we're doing either. So I've been very encouraged to hear, and certainly the feedback I've had around Health Pathways is that the number one thing that's been a big advantage is bringing clinicians together. That, as was said before, there might have been individual discussions on the phone, but there's clinicians that actually haven't met face to face, and you can actually put a face to a name. And building those relationships, we are in a human industry, and I think that actually has a huge impact then on how we provide services. So I think that, just that even as a start point, is a great start point. The ability to work together and actually look at opportunities to redesign our systems. Once again, I think bringing GPs, allied health in the community, pharmacy in the community, and I'd like to think we will bring consumers into the tent as well, because I think it's important to hear that voice and hear what's necessary. And the other thing I was encouraged, and I agree with Martin to a degree around we need to measure outcomes, but I think it sounds like as an organisation, Health Pathways and Streamliners are well positioned for us to be able to look at those evaluation criteria right at the beginning of our process of moving into it. So once again, I'd just like to say thank you very much for coming today, and I look forward to all of us working together to get better outcomes for our patients down the track. Thank you.
Thanks, Margaret. Thanks, Andrew. Just before I finish, the always requisite reminder that you have an evaluation form in your pack. They'd very much like you to fill that in, please, and just hand it in on your way out. And just a couple of final comments before we let you go for the afternoon. I think there's some really very simple things around health pathways that I think that having both your LHD and your PHN here today, and particularly in the numbers that they are, whilst many other people are vital to this, that core partnership between those two organisations is fundamental to make this work. And having that tacit agreement that this journey you're going on, it's not a project you're going to run for a year or two, it becomes a way of working. It's how you decide you're going to try and have these conversations, how you're going to create these redesign processes, how you're going to document what your pathways of care are, and how you're going to adjust and manage those to get the best for your community. And that's really what's pretty fundamentally at the centre of this. And as Andrew said, reconnecting this conversation between primary and secondary care clinicians and using their time well, so that when we have those people together, we're plucking the expertise that they have, but providing a process where that knowledge can go, that they're not coming back round to the third meeting with the same agenda item again, at which point they disengage because they're tired of that, they're busy. So I think that's a really vital thing. I think the other thing as well, this is not a panacea for all your woes. It is not. It is a tool. It's a tool that's very useful, and it's a tool that has got a lot of experience behind it and a lot of knowledge behind it. But I think on its own it can do some things that can make things better, but its power becomes if you can then start to look at how do you reconnect it to the redesign things that you've got going off there. How do you, at the side of that, and I think this is a very important thing that gets forgotten, how do you try and develop a culture across Sydney North that actually gets people thinking we are part of this Sydney North health and social care system? And probably the most powerful thing when I went to Canterbury, and whilst it can almost seem like a trivial thing, I think it's quite a powerful thing about what they've done, is that if I walk into a primary healthcare organisation, into an acute hospital, into an NGO, they don't tell me they work for the primary healthcare organisation, they don't tell me they work for the hospital, they will say I work for the Canterbury health system. They actually see that they're part of this wider system. And it's actually quite important because that cultural stuff alongside the tools that we try to give people to make a better system and a better process is actually pretty fundamental, because it's the hearts and mind stuff that actually kind of helps that journey a little bit. So, you're starting a journey. Some of you will be back here tomorrow where we'll be doing some of this stuff in a little bit more depth for some of the people who will be actually engaged in the doing of this, and hopefully some of you will be joining that party, circus, whatever you want to call it, later on in the things. Graham will also be demonstrating a work group, which is always quite an interesting thing to do, and I think Paul talked really well about the use of those and how they've helped develop some of the stuff in Sydney. So we'll see those people back here tomorrow, work on that, and the team I'm sure will be communicating with you over the next weeks and months about progress, about how you can be engaged in this. So I'd like to thank Lynelle and Andrew for taking you on this journey. You can thank them or whatever you feel later on once you're on the journey. I think it's a great course that you're taking. I think there's potentially enormous benefits for you as organisations if you take those, I guess, some of the lessons and the messages on board. You'll bring incredible strength to it from your own stuff. Canterbury certainly doesn't have all the answers. It doesn't want to pretend that it does. It's the things that you bring to it that make it a success. To the team here who've helped us, Cynthia, Marie and everybody else who've had to put up with us over the last few weeks and months talking nonsense and getting this organised, thank you, it's been excellent. Also as well, particularly to Paul and to Kate for coming along and here tomorrow as well. Their experience is vital, and to the Streamliners team who've come across, and particularly for Matt for gracing us with his presence, late though it was. And to you for coming along today. So, look, it's a great journey. I've seen it from the customer side. It engages people incredibly well in a way I've not really seen something do. It gets clinicians back at the centre of actually where some of the solutions are, but puts a process around it for them that actually can make some of this a little bit more realistic than some of the things we normally have. So go on the journey, enjoy it, engage in it, ask the tough questions, because the earlier you ask those questions, the quicker you'll come up with some of those solutions, and use the community, as Paul talked around, that's actually there, that's getting stronger and stronger all the time and actually learns from each other. And when Paul comes back maybe in a year's time with that graph about Sydney being at the top, make sure you've nicked all of his pathways and you're way above him just to cheese him off at the end. So thanks for coming along. We'll see some of you tomorrow. We're hanging around for a while if anybody has any queries, any questions, and have a great rest of the day.